Welcome to Aging Well in America. I'm Anne Marie Gattari, your host. Today we have with us a very, very special guest, Dr. Christine Chelladurai from the Beaumont Geriatric Evaluation Center in St. Clair Shores.
Correct.
Did I get that right?
Yes, you did. It was beautiful. Thank you so much for having me.
It's great to have you on the show. You often go by Dr. Chella.
I do.
Is that okay? Can I call you Dr. Chella?
Please do.
Okay. Dr. Chella, tell us what is a geriatric evaluation center and why is it necessary?
Our particular center functions as a comprehensive hub. We have board-certified, fellowship-trained geriatric physicians. We have nurses that function as resource specialists. One of our clinics has a master's level social worker. We have physical therapists and neuropsychologists that work with us. And we really function as an interdisciplinary team to provide what I call the comprehensive evaluation for our older patients.
You said a key word there, clinics with plural. So yeah. I'm very familiar with your office in St. Clair Shores, but there are other clinics in the Beaumont system. Where are those?
Correct. We have two. One is the clinic I work out of in St. Clair Shores, right on Little Mac, south of 10 Mile. And then our sister clinic is over in Berkley, Michigan, very close to the Royal Oak Beaumont Hospital, about a block south of there.
I see. Okay.
Yeah.
Are they both about the same age, about a year and a half-ish?
No, no. Actually, our Berkley clinic has been around for decades. And the clinic I practice out of, the one on Little Mac, is relatively new. We've been there almost 2 years now. So we're a brand new clinic established, in this part of the state, and we're really excited about it.
Great. So walk me through what happens. I have an elderly parent who has a primary care physician and many other specialists. Why would I come to you at your clinic?
That's an excellent question, and I get asked that a lot. You know, what do you offer? What services does a geriatrician offer? And I really have to start out by really explaining what a geriatrician is and what they do and why they are specialists in their field. So a geriatrician is a medical doctor that has completed their that have gone to medical school, completed their training in a primary care field such as internal medicine or family medicine, and then geriatricians who are then fellowship trained and board certified do extra training in geriatric medicine. Just like a cardiologist would do extra years in the study of cardiology, a geriatrician does extra years of study in the gerontology field. So what we are trained in and what we are learned to really evaluate are specific geriatric syndromes such as polypharmacy.
Polypharmacy. Let me stop you for a moment. Explain that.
Polypharmacy is patients who are on a lot of medications. The definition really is based on too many unnecessary medications, really, because as we get older, we are having more and more medical problems. Some polypharmacy is necessary. Some patients need to be on multiple medications to manage.
I know, with my own mother, for instance, and I've spoken about her many times on this show, she was on 13 meds at one time and kept saying, you know, why do I need to take all of these? Why? And it did feel for a while that her doctor was kind of just adding on. And
that's something geriatricians uniquely look at is interactions, what is necessary for their medical issues, because managing an older adult's medical problems is uniquely different from managing a younger adult's medical problem. Even simple things as high blood pressure and diabetes are managed differently in an older adult. And so geriatricians, we study the biology of aging, we study how our organ systems change, so we are able to really look at that patient not only organ system by organ system, but as a whole. So patients who have memory problems, they're having personality changes, mood problems, they're getting more withdrawn or more depressed or more anxious. Patients who are losing weight, who are falling a lot, who are in and out of the hospital all the time. So these are some of the unique situations that geriatricians can look at, and we really work with their primary care doctor to provide that overall care, that comprehensive care.
So you mentioned, the clinic, getting back to what happens when I make that appointment and bring my mother. So you look at the polypharmacy, or a pharmacist does, or both?
No, we do, as the physician does.
Okay.
So when a person calls our office and says, yes, I'm interested in getting a comprehensive geriatric evaluation, we actually do require a referral from their current physician, just because we want to establish that connectivity with their regular doctor, because we want to work with them. So once we help facilitate that referral, we send out a very extensive packet that really helps our visits go by really quickly and efficiently.
Okay.
It is a three different sessions, 1 hour for each session. The initial visit.
Boy, that's a change, isn't it?
It is.
You get to spend an hour with one doctor.
Absolutely, and our patients really like that. It's not too much time, but then it's not. It's a manageable time frame for them to spend, with us, because we're looking at everything from head to toe, their past medical history, everything. Our first visit is with, also in conjunction with our resource specialist, who is a nurse, a registered nurse. She will reconcile your medications, perform our cognitive evaluation panel. We perform that on all of our older adults who come to our clinic, and then a meeting with me, and then at that time we actually set out our plan of care, whether it be obtaining prior medical records, prior labs and imaging studies. Our resource specialist also initiates her process of setting up any resources that your loved one may need, whether it be getting home care on board, or getting private duty care, or whether it be getting them in touch with an adult daycare program, things like that.
So the resources in the community.
Exactly.
Even activities such as the senior centers.
Absolutely.
Here in Grosse Pointe we have SOC, Services for Older Citizens. So your nurse actually makes recommendations to
and gets
become
them
involved.
The information for them to make that contact, because majority of my work, I would say only 75% is really medical. The other 25%, maybe even more, is really helping our older adults and even their caregivers connected to these resources to really help support that individual.
Oh, that's wonderful.
And our patients really appreciate that. So then the second visit is where we do the comprehensive physical examination, where we do a head-to-toe examination. At that point, we'll do a review of their medical records from their primary care physicians, x-rays, lab testings. We'll order x-rays and lab testings at that visit if necessary. And by that end of that second visit, we are able to formulate a plan of care for our patient, whether it's revealing a new diagnosis, or starting meds, taking away meds, whatever needs to happen.
I'm assuming after that meeting, that appointment, you are on the phone with their primary care physician. How do those conversations go?
So I do make calls if necessary to the primary care physicians, but majority of the time my detailed report does get sent to their primary care physician. So it's a combination of both, or one or the other, depending on the individual case.
You probably can see where I'm going. How do you coordinate your care with his or hers? Especially if there's something going on in their treatment that you now disagree with, or you feel is unnecessary.
Absolutely. If I'm taking away medicines, or if I'm starting a new medicine, that is definitely being put in my recommendation and being sent to their primary care doctors. And so their primary care doctor can then read through my recommendations and my assessment and my plan of care.
So it's a recommendation, you're not writing the script? Or?
Oh, no, I do write scripts.
Okay.
Yeah, I actually change. I'm not just recommending things. If certain things I do recommend, and I will just leave it as a recommendation. It all depends on what the actual issue is.
I see. Okay.
For example, if I feel that my patient needs home care and some physical therapy, I'm going to order that right away, as, you know, especially if they're eligible for it.
And for home care, again, because there's two types, and just to clarify, one is a Medicare reimbursed, and that's a nurse doing an overview visit with the therapies, and those are generally 45-minute sessions, and they happen a few times a week for a finite period of time.
Correct. On average, maybe 6 to 8 weeks.
Right,
depending.
and then you mentioned private duty, which is where the caregiver comes and stays for an extended period.
Correct.
Okay.
Absolutely. So whether I'm starting a new medication and I feel it's very crucial to their care, I will start the medication, give them a prescription, talk to them about potential side effects, what they can expect, how long they should be on these meds, or the particular medicine that I'm ordering. And I'm looking at, like I said, there are other medications, make sure I'm educating them on, you know, potential interaction side effects. A lot of what we do is educate, and because we have the luxury of the 60-minute visits, we are able to do a lot of education.
Sure.
The importance of hydration, what is adequate hydration for that particular person, because as you know, hydration needs are different for you know, people with different medical conditions, but in general, older adults do have unique hydration needs, and a lot of people don't know that. So we do a lot of education on what's appropriate nutrition, appropriate hydration, medication management, using a pill box, you know, things like that. You know, what is dementia? What is depression in the older adult? So we're doing a lot of education because of that. And you mentioned insurance. We do accept majority of insurances, including Medicare and most supplemental health insurances.
And that your visits don't interrupt with their insurance that is paying for their primary care. So we've been through the first 2 visits. Now visit 3, what happens?
So the 3rd visit we actually offer as an optional visit. We call it the family conference, and it really functions as a kind of wrap-up visit, kind of like a huddle. Where we, with the patient's permission, we invite loved ones of the patient that want to attend. For example, if I'm dealing with an older female, her spouse and her children may want to attend. And we really, that 60-minute visit really functions as a forum for me as a physician to let them know, obviously with the patient's permission, what the results of the evaluation was, and then provide education on what the diagnoses and what medication changes have been made, and then also have the family ask us questions about what do we do about this, what do we do about her social activity, what do we do about her driving, you know, what do we do about you know, her supervision with her meals because she's not eating well. So things like that. I'm just giving examples, but it really allows the family to ask us questions and really be part of that patient's, that individual's care. We also take this opportunity to talk about advanced care planning, which is very important and crucial, especially as we're getting older, to have those things in place.
Oh, that's wonderful. So you're in the Beaumont system.
Correct.
I'm assuming you're getting referrals from your colleagues in the Beaumont system.
Absolutely,
Is that
but
where
we also
where most of your new patients come from?
Actually, I would say our particular clinic, we've seen pretty even numbers from all across the board in this area. I've seen patients from the Henry Ford system, St. John, you know, the McLaren systems.
Yeah, is that right?
So it's not only Beaumont, but we see patients from other healthcare systems as well. And it doesn't matter, as long as we know the name of your primary care doctor and their number, we can always call and get their fax number and establish that communication. So, because that's really important.
On occasion, I'll run into an elderly loved one who has no primary care doctor, and they're looking. Are you able to serve that role?
A geriatrician can function as a primary care. Like I explained before, we are all trained as primary care physicians first before we go on and do our subspecialty in geriatric care. So as a geriatrician, we are essentially primary care physicians. My clinic in particular, just to let everyone know and your audience know, that my clinic in St. Clair Shores, we don't see primary care patients. We're only seeing consultations at this point. But if you need a primary care physician in this area, area, we will refer you to several wonderful physicians that we know. Our Berkley office, however, does take primary care patients if you're closer to that area.
Okay, wonderful. That's great to know. So, I'm curious to know what led you to geriatrics.
Yes.
When you're in medical school, you're looking for, I know there's a lot of pressure to become a specialist in some ways, in some areas. So what led you to geriatrics, Dr. Chella?
Yes, it's been a wonderful journey, and I'm so glad to be practicing what my passion is, and that is serving elder care. How it really started was I always wanted to be a doctor. I actually did not have a plan B. I knew that was my ultimate goal, and my ultimate goal was to be a primary care physician. I didn't want to focus on just one special organ specialty like cardiology or nephrology. I wanted to serve the whole patient and their family. So when I was going through my medical schooling and training, I had a wonderful mentor who was a geriatrician, or is a geriatrician. He's still practicing in East Lansing.
Where did you go?
I went to Michigan State University.
Oh, wonderful.
Yeah, for College of Osteopathic Medicine.
Okay.
And so he's a geriatrician on staff there, and you know, just working with him, and he was a wonderful mentor for me.
I see.
And really helped stir up my passion for not only primary care, but geriatric care. And I look at my own aging parents we're all getting older, but you know, looking at my parents and them getting older, I really knew that, you know, I wanted to help that particular generation, you know, and so that's where it started, and so my entire focus was adult medicine. So my residency was actually in internal medicine, and then I went on to do my geriatric fellowship out of William Beaumont Hospital in Royal Oak before retaining with Beaumont. So now I work
So you were there the day the doors opened, almost 2 years ago.
Correct.
On Little Mac. Tell us how it has changed. Is it what you expected it would be? Has it evolved? Do you see that there may be some differences coming down the road? What?
Absolutely. It has actually been more than what I expected. The great reception that we've received from the community, it has been wonderful. You know, when we started this clinic, it really has given us an opportunity to meet a lot of wonderful people, even such as yourself, who are really passionate about elder care. I've met with wonderful people who work for the SOC, the Services for Older Citizens, and all these wonderful organizations that serve the elderly. So it's been wonderful. We have not reached our potential. There's still wonderful things that we want to do with our particular clinic on Little Mac in St. Clair Shores, and we have great hopes and dreams for it, but right now it's wonderful. I have a wonderful staff. Jennifer Lacoste is our nurse and resource specialist.
Give a shout out to Jennifer. She is amazing.
She is wonderful. I mean, she's literally my other half, you know,
she shares your passion for the elderly and their well-being. You do make a great team. Yeah,
and Debbie is our medical assistant, and we call her our geriatric whisperer, because she just knows how to make our patients comfortable, because it is nervous when you come to a physician's office, and you know, it's so much time that you're spending there, and so she's wonderful. And then we have a wonderful front desk that really know how to answer those calls and really get our information out to them, to, you know, of what we're about. So it's wonderful. Right now our particular clinic, we're open 3 days a week, but like I said, eventually we want things to grow. But our Berkley office functions 5 days a week. Yeah.
You're in the Beaumont system. There are geriatric specialists who are not necessarily associated with each clinic. Is that true?
Correct.
Okay.
Our particular clinic has, our particular group, I should say, between the two clinics, and then we also have several nursing homes we're affiliated with in the Tri-County area.
And those are? Do you want to list those?
Absolutely. I'm the medical director of Shore Point Nursing Center out here in St. Clair Shores, right on Jefferson. And then I have colleagues who are medical directors of Woodward, Nursing Center, Shelby Nursing Center, Evergreen Nursing Center in Southfield, and I'm missing one more, West Bloomfield.
Oh, my.
West Bloomfield.
Okay,
So there's 5
so
that we are medical directors
that's
of.
wonderful.
And then we also have a geriatric hospitalist based out of Royal Oak primarily, and then we also have outpatient physicians such as myself and a couple others. There's 11 geriatricians in our group,
wonderful. Oh,
but there's also
that's
other
great.
geriatricians
Sure.
within the Beaumont Health System that are not part of our group.
I
Yeah.
see. And these are doctors that you would refer to if somebody came and needed
Correct.
primary care.
Correct.
So when you look at your overall population, is there one issue, one concern that jumps out that is like heads and shoulders above the rest, or is it more of a mix?
It is more of a mix, but I would say something that goes often undetected, or I wouldn't say undetected, it's hard to diagnose, is a lot of mood problems in our older adults. Mood disorders can look quite tricky in an older adult, and what I mean by mood problems are depression or anxiety that's pathologic, and it can often mimic itself as memory problems. It can mimic itself as weight loss. It can mimic itself by, you know, socially withdrawing oneself from, you know,
that's
from
fascinating.
things. So it's really, you know, some people might notice, oh, you know, my mom's just more confused lately. She's, you know, not going to her appointments. She's missing her appointments. And well, I'm worried she has dementia. Well, certainly that's one thing that you should think about, but it's oftentimes older adults aren't screened properly for mood disorders, and that can be easily treated. So,
For instance, give us what's a typical mood. Well, you mentioned anxiety and depression.
anxiousness and depression, absolutely. I mean, I have several cases that I can think of. I have older patient of mine. She was wonderful. Her children actually lived out of state.
Okay.
And she was the only one in she lived in Michigan, but she had great support system with her church family and her friends. She was having some eye issues, so she wasn't really driving as much over the last couple of years. But then what her friends were really noticing was she was going to her appointments in an incorrect time. So like her hair appointment, she would show up on the wrong day. You know, she would go to the bank unnecessarily and things like that. So when she came to our office, this was eventually reported to the children of the patient, and then the children then helped her get into our office. And then once we saw her in the office and we did memory testing, we screened her for depression, there wasn't really a significant cognitive impairment in our person. She was very insightful.
Interesting.
She did not have anything like dementia or anything like that. What we really found was she was developing more of an apathy and depression. And so we initiated some medications for her, and then we set up a follow-up time, and she's doing quite well. We even started her on some therapy too, which really helped her as well.
So an antidepressant
Correct.
sometimes
Exactly.
can help with confusion.
Absolutely. Well, it can, depending on the root of
The confusion not being rooted in dementia, as you said. But
correct. And that's the key. We have to, like I said, it's not just prescribing a medicine, it's about looking at that whole person. What else could it be? What else is it not? Because confusion can not only be a memory problem or a mood problem, it can also be, for example, an infection that can be treated, or a metabolic derangement, like a kidney problem or something like that, that can be fixed.
So what's your main message to adult children then who are really trying to get through the day?
Absolutely.
They're trying to continue their busy lives with work, often, you know, teenage or older children, maybe grandchildren of their own, and their aging parents are just really weighing on them. And I speak from experience because that was what my sisters and I and my brothers, quite frankly, but as we know, the
it is very
sisters
difficult
are very,
and
very involved. So what's your, and I remember just, you know, being frustrated and wanting to correct her and you know, send her this way instead of her wanting to go that way. And what would be your advice to...
My advice would be, it's okay to worry, you know, but what I really try to educate my adult children, or at least children of my patients, is really look for signs, you know. Being really proactive can really help catch things early. So look for signs that your parent, your older parent, might need help, whether it's changes in their weight, changes in their personality. Well, my mom has always been a social person, but now she's not so social. She's not participating in things anymore. Or, you know, she's always been a neat person, organized person, but now I went to her home for a vacation and things are all over the place. She's not tending to her personal hygiene or his or her personal hygiene. So pay attention to those things and be proactive. Whenever you see these things, talk to your primary care physician, or get started with a geriatrician, and we can help facilitate that referral from the primary care physician. Get them to our office, because then we can really, whether it's taking away medicines or starting a new medicine, we can really help get the resources that they need. Because, like I said, you know, 75% of what I do is actual medicine, you know, but really that 25% plus is really getting that support, not only to the individual patient, but to their loved ones. Because it is stressful, it is hard, especially when your older adult is going through a lot of medical changes. So we're really there to provide that support, because they do need support.
Yeah, I think it's too easy sometimes just to chalk it up to, you know,
they're 85. I hear that so many times, Anne Marie. Oh, she's 85. What are you going to do? You know, that's part of being, and it's almost like irritates me a little when I hear that. It's like, yes, they are aging. There are changes that are happening, but memory problems that affect someone's ability to function in their home, mood problems that affect someone's ability to function in their home is not a normal thing, even for an older adult, you know, no matter what age.
And then you've got the spiral, right? They can't do for themselves, so the independence gets lost, and then the depression and
then they're not eating well, they're not drinking well, they're getting infections, they're getting hospitalized, they're getting weaker, they're falling. It's just, it's like a domino effect, and we really want to help support and provide wellness and prevention, you know, and education.
That's terrific. Well, thank you so much. If you can believe it, we're at the end of our half hour.
Oh, wow.
I know. It is.
It's
amazing. But we do want to encourage our viewers to seek out the Geriatric Evaluation Center run by Beaumont, both here in St. Clair Shores and over in Berkeley. I want to thank you so much again for attending.
Thank you for having me.
We've come to the end of another episode of Aging Well in America. Please send us your ideas on what you would like to hear us talk about and people you'd like to have us interview here at the Grosse Pointe War Memorial. Thank you and goodbye.